Welcome to what I hope will be a productive fact-finding hearing on a subject I have long been interested in, antimicrobial resistance, or AMR. We heard in yesterday's hearing that the risk of a pathogen escaping from a lab and causing a pandemic is very real. Just as real is the threat posed by antimicrobial resistant pathogens. Prior to the discovery of penicillin, significant research was being done on bacteriophage or phage therapy. Phage therapy is where we search for a virus to attack harmful bacteria. Ever since the discovery of penicillin, antibiotics have been developed to treat previously untreatable infections, and they truly are lifesavers. But unfortunately, as the development of antibiotics took off, attention to phage therapy fell to the wayside. Recently, the CDC and NIH are studying and doing more research into phage therapy, but more is needed. The problem is, over time, pathogens become resistant to the commonly used classes of antibiotics. Accordingly, if a new way to kill the pathogen is not found, the patient is defenseless to the disease caused by the pathogens. As it stands right now, antibiotic-resistant infections can be extremely difficult to treat. AMR is often referred to as the silent pandemic and has become one of the biggest medical concerns today. The pipeline for AMR drugs has slowly been drying up due to various reasons that deserve our attention and which we hope to highlight today. Despite the increased demand, there has been a significant reduction in investment and development of new antimicrobials. According to data, since 1990, 78% of major drug companies have cut or scaled back antibiotic research due to developmental challenges. According to the Centers for Disease Control and Prevention, at least 2.8 million people, that's right, 2.8 million people are infected with antibiotic-resistant bacteria in the United States each year, and more than 35,000 people will die as a result of such infection. The rise of drug-resistant infections places a heavy burden on our nation's healthcare system. The CDC suggests that approximately 30% of all antibiotics prescribed in the U.S. are for infections that do not necessarily require antibiotics, which amounts to about 47 million antibiotic courses prescribed in these settings each year. That said, often what happens is individual doctors faced with perplexing symptoms while trying to save their patients will understandably turn to antibiotics. AMR is not just an issue that arises in a hospital or healthcare setting. Antibiotic usage in humans and animals all have the possibility of developing antimicrobials with expanding resistance. And it's a problem that sometimes we don't understand everything that nature's doing. I recently met with a veterinarian and a professor from Virginia Tech, which is in my district, about her work in southern Africa. While there, she came across abandoned mongoose who had an antimicrobial resistant to antibiotics that she'd never seen before. This shows that the antimicrobial resistance can appear anywhere and everywhere. I look forward to hearing from our witnesses about potential innovative solutions like phage therapy. I expect we will also hear today from the GAO about deficiencies at the Department of Health and Human Services, the agency with the most responsibility for tackling the AMR problem. One issue that I hope we can shine a light on and bring more oversight into is the number of federal programs and initiatives the government currently has to address antimicrobial resistance. While I'm pleased to see we are addressing this silent pandemic, it is Congress's duty to provide oversight into how dollars are being spent. Have the various programs found any success yet? And which of these programs are duplicative? As we consider potential solutions to confront these antimicrobials, we must consider the work that is already being done and the dollars already being spent to combat this crisis and look for ways that will yield more successful outcomes fighting these superbugs. While there is no easy solution to the problem of AMR, we are committed to exploring potential solutions to address this public health crisis. I want to emphasize and be clear that this hearing is not about taking a position on any legislation introduced, but rather, as this committee usually does, it is to gather information and to find out the facts. Our goal today is to examine the AMR problem, assess the role of the federal government, and explore potential solutions. I look forward to hearing and learning from our great witnesses who are here with us today. With that, I yield back